Dr. Mary, thank you very much for setting up all the science part around migraine and the clinical part, because even so, I'm from Novartis, and my disclosure is, yes, I am a full-time employee to Novartis. I will not talk about any specific therapeutic options, but I want to talk to you about what we have done at Novartis once we have understood what migraine means. Because we started to learn what migraine means for society, for the individual, of course, but as well for the employers by indeed the drug research that we have conducted in that space. And then we, of course, look very closely at the patient journey. And then we thought, wait a moment, we cannot ignore this. I mean, this is obviously something that for us as an employer has a significant relevance as well. And then the question was, what can we do in order to help people living with migraine? And this is kind of what we try to capture under the aspiration of we get migraine. So that actually we at Novartis, we want it to be okay that people get migraine. This being a patient sometimes is just part of normal living, but we want everybody else who doesn't get migraine, clinically speaking, that they get what migraine is. So now my slides are, so when you look at it, that calls on duty then Novartis as an employer and our comp and ben and well-being aspirations and activities that we run. And of course, when you look at your well-being, and I guess we have a couple or most of you are in this space or as part of the H&R teams in your companies, they have a very important role, but they face a lot of different challenges as well. So when you want to set up a well-being program and you want to support your associates on something, of course, it has to be attractive and meaningful to really kind of enable sustainable work performance, because that's at the end, it's about performance as well in a company. From an occupational health perspective, of course, you absolutely want to make sure that you have fulfill all the safety and health environment criteria for the employees. And I think the employees are the strongest stakeholders in this. It has to be relevant and impactful. And I think we all might have certain well-being programs that, for example, we sponsor a gym as well at Novartis, and we just see all these super fit people in the gym. So we don't need them in the gym. They are doing sports already anyway. So the question is, can we make it more relevant maybe for those ones who actually would be benefiting from such activities? Corporate social responsibility, of course, we are corporate citizens, so we want actually as well to take care of the health of our people, because they are all the employees build a society, and indeed very often they are a pillar to society because they make our national economies run. Finance maybe is sometimes your counterpart, and they might give you a challenge on everything you do because they say, where is the return of investment? And I'd rather see you being a cost center than being a profit center. So what can we do about it? And what I want to show with you is that having discovered migraine as an area, that we have developed something that actually we could satisfy all of these stakeholders. And I think that actually really then helped us not only for migraine, but it helps us as a function as well within the organization, that investments into employee health make sense. So we have talked about already what migraine means, and just to translate it into a couple of numbers specifically for one employer, because when we hear these massive numbers, very often, at least my brain cannot capture what is a number beyond a couple of thousands, basically, because my brain is not engineered for that. But from the qualitative side, the stigma is massive. And you just don't realize it because stigmas are something people don't talk about. So if you're actually not a person living with migraine yourself, then you don't realize it. And people living with migraine will just hide to their very best that they live with migraine, which really leads to the fact that we haven't seen this issue. We have been completely blindsided on this issue of stigma. The level of impairment, we have done our own research and surveys, and indeed, on average, the people living with migraine, on average, were impacted on 20 days. So again, here you see the numbers are all kind of slightly different, but they have one thing in common, they are quite high. What is very important to point out here is that the majority of the impairment and loss of productivity is presenteeism. So you don't see it in your sick leave requests. You don't see these people showing up because they, due to the stigma, would just carry themselves into the office for whatever happens. Because they are concerned, it might be career limiting, they might be perceived as too vulnerable to stress or just not strong enough. These are kind of just the typical stereotypes that are now running around. And when we then look at the high need, we kicked the whole journey off by saying, okay, what shall we do? Okay, let's do a bit of a lunch and learn. There was at the time we still could do lunch and learns because we didn't know what Corona was. And we rented one of these meeting rooms or auditoriums that we have at Novartis, and where normally when we run these type of health-related lunch and learns, we have 50, 70 people at the very best. And then we thought, okay, let's do one on migraine. Actually, we had more than 300 people joining, but more than 6 times the number of people joined this one. And then we really thought, okay, there must be something. There is an issue. If you sum all of that up in numbers, you actually can see that it's worth looking at it, because just for Novartis in Switzerland, so that's 12,000 associates, the economic cost of migraine is about 16.6 million. So that's a long problem set up, but then we thought, okay, what shall we do? And then we thought, okay, we're having this journey from our well-being, where we have started. 10, 15 years ago, we just looked at everything that goes the neck and below. Everything was about fitness, nutrition, know your numbers, cardiovascular and metabolic aspects, until we started to realize, as a predominantly brain worker company where almost everybody kind of stands in a lab or sits in front of a computer, the majority of impact and the sustainability performance that we should try to create and well-being is actually from the neck upwards. And of course, everybody is now doing mindfulness because everybody can benefit from it. And where we want to head out is, of course, burnout and depression, but this is kind of even more stigmatized. So then we kind of thought, so maybe migraine and doing something for migraine could be a bridge post on the way there, because it fits very nicely into the brain health journey, and it's still a distinct neurological disease. So maybe it can help us that we kind of can indicate that we seriously take care of the brain health of our people. So what have we actually done? Well, the first one that is not on the slide here is we started to look for offerings. Is there anybody out there that runs programs for people living with migraine? And we couldn't find anybody, because nobody had migraine on the radar, because it was hidden in all the companies, and even typical well-being providers and typical healthcare, occupational health organizations just wouldn't offer anything. So we thought, okay, fine, then we just do it ourselves. And we built a program that had 2 main pillars. One was about increasing the understanding, which is all about reducing the stigma, because the stigma is a significant part of the burden of migraine on the people living with migraine. So we actually thought we educate everybody in the organization about migraine. And of course, you do it in an entertaining way. So people actually have fun while they learn. We had some special attention for our managers, so they start understanding as well and don't judge on people who kind of say, boss, I need to really go now. Can I just kind of whatever? And then they think, oh my God, what is crazy with that person? But that they really understand it from their perspective as well. So this is the whole pillar about increasing understanding. But then we thought, okay, you know, if you have this magnitude of an issue, just education will not fix the problem. And maybe we can't fix the problem entirely, but we want to try harder than that. And then we thought, okay, can we create a disease management program for our associates living with migraine and actually their family members? So we pulled together the medical society, patient group, digital and telecoaching experts, and we created a program that really is remote, so it works well during Corona times as well. That is built on evidence, but it does look at all the options that a patient should leverage. And this is like Dr. Mary said it before, you know, very often we talk about, doc, give me a pill so I'm better. But very often it's not a pill that fixes the job. But if we do and combine lifestyle and medical treatment options, we can actually very often achieve much better results. So this program now combines this digital coaching for the human touch factor that we think is incredibly important because these people need the empathy and the understanding. And it combines it with an advanced version of Migraine Buddy, actually, that was mentioned before earlier. So in these different coaching sessions and supported by Migraine Buddy, there are basically a set of modules that the coach, in discussion and alignment with the participants, identify as areas of improvement, that where they could work on and where they want to work on in order to achieve the personal best living with migraine. So here you can see a couple of modules on the left that we have started with, and you can see actually that a lot of them are looking at lifestyle aspects. Others look at how shall I talk to my doctor? What type of documentations do I have to bring to my doctor? It of course provides you with background on the disease a little bit along the lines that Dr. Mary just shared with us before. So it's kind of a pretty holistic program, all with the objective to empower the individual and the objective to then support them to achieve their personal best. So now my computer just would not advance any longer. Yep. So what have we found out in the program? So first of all, we had more than 350 people joining, which when you look at the prevalence numbers that were shared before, this is roughly 50% of our target group, which we've never achieved with any other well-being program ever before. And it's people signed up to this program who had at least moderate impairment due to migraine, because we thought, okay, it's a pretty big program. So somebody with one attack per year maybe is not the right target group, but actually the majority really had at least 5 attacks a year. Most of them had between 2 and 8 migraine days, monthly migraine days. So our hit rate was pretty good. So we were very happy about that. And it's by far the biggest program that we have in this area. The first thing that kind of shocked us was that we thought, while we are a pharma company, of course, our people know much more about their health and their health management than maybe average people. But we learned that it was exactly the same number of 1/3 of the people who never ever had a doctor validated medical diagnosis of their condition. Which for us came a little bit as a shock, because if you don't know what you suffer from, how do you actually seek advice and try to optimize your situation? What we have found as well is that actually through the education, even so we thought our people are already quite qualified, the patient empowerment index significantly increased. So actually the people benefit massively in terms of how confident am I in terms of managing my disease. So here really it's all about the empowerment of the people. And what was the nicest surprise for us is the adherence. We had 70% adherence. 70% of the people who signed up to the program in the beginning actually finished the program, which I don't know what your experiences are with such programs in Ireland, but for a 6 to 9 month program, having a 70% adherence rate is absolutely outstanding, very much to our surprise. And it just shows how much the people benefited from the program and that they could after every coaching session take something out of it for themselves. Of course, these are kind of soft criteria, so let me share with you kind of a couple of harder outcomes. So we have attached a study to it where on an anonymized and aggregated level, we could explore how the burden of migraine reduced over time in this program and how much days, actually migraine-free days, people gained from this, which you can see on this slide. So there is one parameter, one measurement, one KPI, you can call it whatever you want, which is called MIDAS. It's the Migraine Disability Score that basically all clinical trials and most projects are using. And what you can see here on this slide is actually we managed to reduce over the period of time of the program itself, the burden of migraine for these people by 54%, just by empowering them to leverage lifestyle and medical options. And this effect was sustained and even improved 3 months after the program, so that at the end, they only had 1/3 of the impairment of migraine left, which for them translated into, and this is probably much more tangible, in 11 more days per year, where they were not impaired in their work, and even better, 14 more days where they were not impaired in their private life. So that's a 2-week summer vacation where they basically now could enjoy, because they had no migraine. That you have maybe higher numbers in the non-working days, very often is explained that a lot of people actually suffer from migraine during their weekends at the time where they should be recovered, because that's where they break their rhythms, that's where their sleeping habits are different and so on. And that's where very often they are being hit by a migraine. So coming back to the starting point, we're kind of saying, okay, when we bring all the different interests together from participants or associates, HR, and so on. So I think we could, HR colleagues were super happy about this program because we had this very high employee satisfaction and a very high demand. So it was actually a unique program that associates could not get otherwise, where other types of nutrition advice or mindfulness exercises are commonly available to them. From the scientific perspective, of course, achieving a 2/3 reduction in terms of migraine was really meaningful. For our associates, obviously, when they 70% stick and finish the program, we truly believe that we added good value to their lives. Which then ultimately, of course, was translated into increased commitment of these associates to the company. Due to the increase of productivity and working days that I've shown you before, actually there for us as an employer, there was a return of investment of 490%. So it's actually allows us to claim now that we are not a cost center, but we're a profit center. And this is the way how we believe if more companies undertake efforts in supporting their associates, actually we can change the way how the societies look at and treat migraine in the board. So just to close on some stuff that is available locally already in Ireland itself. because this program, as it was shown, was run in Switzerland. All the insights and materials are, of course, available if you want to repeat something like that in your own company. But if you want to have some low barrier, ready to use materials in order to start maybe some awareness in your organizations, there are materials from Novartis in Ireland available as well. One that kind of summarizes migraine at work, and one which actually could be a good trigger in order to start even at times of Corona, because Corona actually, this is a survey that explores how Corona and lockdown has changed migraine for the people, and where you kind of see that actually the majority of people suffer more severely of their migraine during the Corona times and during the lockdown. And I know that many of you try to support their associates at their best, which is even harder when you don't have them in the office and when you don't have them on site. But again, here, at least with education, you can signal very clearly, hey, we are here for you, to help you, and start such at least education campaigns as I just shared with you. So thank you very much for your attention and time. And I hand it back, and I think over to give you the perspective of somebody living with migraine actually, and get the personal perspective of it.
That's brilliant, Leo. Thank you very much. I'm really sorry, but Marie has additional technical difficulties, so she's vanished just for the interim. Hopefully she'll be back soon. But Leo, thank you very much. That was really, really interesting, and really it was very enlightening about showing what a program can do and how much of a difference that something that integrated can help, the changes that it can make for people with migraine, to get everybody involved in that way, and to have such a big reduction in migraine days, and also in presenteeism, as it were, and absenteeism. It'd be interesting if you had any information on the reactions of people's colleagues afterwards, where, you know, if people felt differently about their colleagues, you know, with the quote that you gave there about people wishing they had migraine so they didn't have to show up for work, things like that, if that kind of thing had changed.
Yes, I think that there are a couple of anecdotes I could refer to. Maybe to kick it off with some data, what we have seen is that actually our presenteeism decreased dramatically while the absenteeism stayed in a similar range. Mm-hmm. Which for us was exactly the message that we wanted to give. You know, don't come if you're not feeling well. Stay at home or go home, because staying at a noisy production line or in a lab with strange smells, and it will not help you make your migraine go away. So you better go away and fix your migraine, and then you come back. So that's where actually we didn't want to reduce absenteeism. We wanted to reduce, we wanted to empower people to do what's best for them. And very often this means maybe going home as well, or not coming to work in the morning. We had a lot of nice episodes where people were telling me, but kind of saying, I was in a meeting room, and then I didn't feel really well, and I just told the people, and then somebody said, oh, by the way, but the light is really coming badly from the side, you know, maybe we close the blinds and so on. So there was an increased sensitivity, and that actually very often we had people as well that one said, it was a team leader who actually said, look, I didn't know I had 2 of my team of 7 had migraine, and I had these people for 3-4 years in my team. And I didn't know, and based on this campaign, we were in the canteen together, and then we basically looked at that and discussed. And at the end of the lunch, the people said, but you know, boss, that I'm one of those people as well. And then they kind of developed a completely different approach in how they handle it. And while very often there is no general, every migraine is different. And so very often there is no one rule that you can do from a corporate level in order to do the best for an associate. But if you start with the mutual intent to find the right solution for somebody, then very often I think there can be good results being achieved between a manager and an associate living with migraine.
Yeah, absolutely. That's brilliant. It's fantastic. So it is. Thank you so much for that, Leo. Very, very much appreciated. We'll move on. And Maria's back, thankfully.
Maria's back. Maria's very stressed because everything just went blank on me. So my sincere apologies for that. And I'm so lucky that I had Deirdre as my wing woman. So thank you, Deirdre. So sincere apologies for that. So Deirdre, you asked Leo some questions there, and it sounds like you're getting some great answers. Are we ready to move on to Claire, or were there more questions for Leo, or we wait till the end?
Just bear with me for a second. I think we can wait. We can move on if that's all right with everybody. Thank you, Leo. We can come back to questions at the end, if that's okay.
Absolutely.
Thank you so much. And apologies if you have spoken to Leo about this, Deirdre, but just before the world went blank for me, I was really struck by Leo's slide on stigma and people's attitude. I think that the quote from a co-worker was, "I wish I had migraine and I wouldn't have to do my work." So that's really interested to hear from Claire, Claire, if you're coming in now, I'm hoping, because unfortunately I can't see anything except my own face at the moment. Which is looking very stressed. So Claire, if you could come in, and if you're coming in, we're really looking forward to hearing from you on what it's like to be an employee with migraine. So Claire, are you ready to come into the conversation? Super.
Thanks, Mary. Hi, everybody. Again, an honor and a pleasure to be here, and awe-inspired, I guess, by our previous speakers. Really thrilled to hear that a company such as Novartis has put such an amazing program together. It has been my experience for many, many years as a migraine sufferer myself in the workplace, that it is only with such conscious support of staff that we can actually address the challenges that migraine sufferers really face in the workplace. And if I can take myself back a couple of companies ago, where I was a manager, but I guess one of the things that we have to respect is the fact that, you know, many of our speakers, Mary talked about courage, and Leo talked about empowerment. That's something that hasn't really been very easy for migraine sufferers in the workplace. You have to be able to, in the current or in the past Irish environment, very much be that courageous person, stand up for yourself, speak out, to be able to even access minor accommodations. So if I take myself as an example, working in a financial service organization in a shared office space, that shared office space has many, many potential triggers. And I think Mary alluded to the fact that the triggers aren't just one event, they can be a combination of things. So let's say it was a long day the day before, it was kind of stressful in work, and the next day you're in the office, you're already heading toward a migraine and the lighting affects you. So for me, for example, I'm incredibly photosensitive. It's primarily fluorescent type lighting, LED type lighting. So even in the more modern offices where we're no longer dependent upon fluorescent lighting, we've got this super bright LED light, and it's environmentally fantastic from a climate change and a cost perspective. But from a migraine perspective, for me, it was hell on earth. Incredibly severe pain, like putting an axe down one side of my head through my eye. So the accommodation that I sought, I'd simply had a chat with my management and I said, look, is it possible to sit me somewhere where I'm not affecting anybody else around me, but that you could turn the light off over my head, that one little lighting unit, or sit me away from it. So can you please find a darker corner for me, in other words? And I was really lucky. They listened, they understood, they helped, and that reduced the opportunity for those escalations, that increased degree of triggers to build for me. Now, I carried that experience with me. I was lucky. Again, I'm not the shyest person on earth. So it meant that when I went to my next organization, who had that ultra modern office, super bright, reflective surfaces, white desks, that I was able to say, this environment physically hurts me when I walk into it. Another element that Mary's diagram of the office and the potential triggers in the office mightn't have covered would be patterns. So patterns, severe patterns on the wall, maybe an installation that looks lovely from an art perspective but has close patterns in it, or even carpets can be one of those accumulative triggers that cause people pain and build into a migraine. So it's amazing how as time progresses, you learn as a sufferer what are your kind of danger points. Modern lighting in cafes, those lovely modern bulbs, clear bulbs where you can see the element inside, I can't look at. Now again, because I'm fortunate that I'm a bit outspoken at times, I would have turned to my colleagues at the time and said, look guys, can we move somewhere else? Can we eat in a corner of the cafeteria that's darker or quieter? Can we go out for a coffee? And in fact, in the end, they actually learnt what were my triggers, and they would get there ahead of me and pick a table that we could sit at where I would be looking outward, perhaps into the daylight rather than inward into the bright light of a cafe and so on. And I guess that's ultimately the lesson I took with me from organization to organization, is that if I was brave, if I could take that first step, if I could open the door a little bit, that I could be supported very much in a natural way by most people. So, you know, those who are unable or feel lack of confidence in actually sharing their story, their colleagues, as we've just pointed out in a number of different points, don't know, can't help, don't understand. And the return as an individual of you taking that brave step is fantastic. You get that understanding more so with your team, your management and so on. And I guess that's my experience. The current company I worked for, the minute I did an interview with them, I said, by the way, just to let you know, I have migraine. It's chronic. It's more than 15 days a month. I manage really well. I probably suffer quite a lot from presenteeism, actually, now that I come to think of it. But at the time, wasn't familiar with the word. And I said, if you can help me, identify the right environment, the best environment in the office, I'll be able to be more comfortable. I'll have less migraine. It'll impact my work less. And they were amazing. Before I even started, they brought me to where they felt, they'd looked at the office layout where they felt would be the best place for me, beside a big open window. They had showed me how they were going to move the light fitting away from me. It wouldn't interfere with anybody in my immediate location. We talked about that point that I think Mary raised earlier on about having a restroom. So they brought me to the first aid room and they asked, you know, would this work for you when you need to take your medication? Can you move in here? And so on. And it was fantastic. I really felt that I could bring my talent to that organization. They could value me in a way that perhaps others might not have really been able to do in the past. And that understanding has built over the years. It is, however, in Ireland, very much so that the individual is the brave one. The individual is the one that stands up. And that's why the Novartis program that Leo's just talked us through is phenomenal. It's that safe environment we always want to work in. We want to bring our whole self to work. We want to be open about the challenges we face and not feel that people are judging us, that we will be stigmatized as a consequence of something that people do not understand. And migraine isn't just a headache. It is a phenomenal experience. It is so bad, so painful, so prolonged. As said, you know, more than 15 days a month for me. And you heard at the introduction that my family, I'm fourth generation. One of my children, my daughter, who's 26, has lost 8 years of her life to new daily persistent headaches. She's fully disabled. So we don't want people to single us out particularly, but minor accommodations can really bring us into the family that is an office environment or a professional environment, somewhere we can bring our whole selves, as I said, to work. It's really important from a diversity and inclusion perspective. I, as the bio kind of led to, I'm a manager as well. I have my own team. In my team, we have a very stressful role, business resilience, especially at the moment. Everybody knows what we do. Everybody understands the terminology about R numbers and working from home and that social distancing, all the terminologies that we've been trying to help everybody understand for many years. But it's a highly stressful environment to manage that situation on behalf of a business, to help them through it. We help them plan for it, we now help them implement it and action it. And so that 7 staff are covering 16 locations, all having COVID-19 responses at different rates, all highly stressed. But they all understand migraine. 3 of the members have it. We are open about it, we talk about it, we say, look, guys, can you take over for a period? I need to go and take my medication. I'll let you know if I can't come back. And we're very supportive of one another. So I think, again, I as a manager have an obligation, duty of care to my staff to make sure that that environment is available to them as well. And I guess it's really important that they feel that they don't have to be that presenteeism person. They don't have to work their way through it. That they will be accommodated if they need to take that break with understanding and compassion. And I think that's hugely important. So I'm kind of looking here at my notes. What else did I do? And again, it's not all about just me as the manager, but me as a sufferer as well, raising awareness. So I work with Migraine Ireland as much as I can to help advocate. I bring that into the workplace. Every one of my last three employment teams, we have actually brought Migraine Ireland in. They've helped us run awareness sessions. I run awareness sessions on my own as well. I'm practiced at it, I can do that now, it's easier. And we bring people to sessions where they get to understand what migraine is about, they get to talk to one another and build a network. They can then self-support more. They can share the frustrations, the anxieties, the pain that they suffer. They can discuss what it's like to be a parent who has a child at home with migraine. So it's not just the employee who has migraine in the office, but it's those who, we now know there's such a prevalence, 500 or 700,000 in Ireland. Everybody probably knows somebody with migraine and may have to be a carer if they're not an actual sufferer. So, you know, having that capability of helping them understand and fulfill that need and be more empowered. I think Leo mentioned that quite a lot. Empowerment, I think, is hugely valid. What we did in my organizations is we used material, that pamphlet that, or the infographic that Leo showed on migraine at work. I actually was part of the focus group that developed that with Novartis in Ireland. And it was thrilling. It was a pleasure to see somebody interested in actually helping raise that awareness. So that's in all of the offices that I support at the moment. We have a day a year, which is on the 21st of June, which is around migraine awareness. And it's wearing a shade on the longest day of the year in the Northern Hemisphere from a lighting perspective, just to draw attention to why would a person in work maybe have a pair of sunglasses on or a peaked hat? It's to understand that they're trying to shade themselves from light, and maybe we could all understand that a little bit better and help them. I've set up a page on our intranet site, which is a community page where people can network and share their own stories, a little bit of a blog. You know, I post links to interesting information as I find it. Hopefully, if I can post the link to this afterwards, that will help somebody else. But it's all a matter of creating that that self-aware environment for the staff member not to have to be so brave, but to be safe, feel safe and empowered to come forward, talk about their condition, which is highly complex. And to Leo's point, that return, not just a return on investment, but that return in empowering a talent base and wanting to stay with your organization because you understand them and they feel valued. I can only tell you that from a one-to-one perspective, when I get an organization to understand me and my situation, it makes me really proud of who they are and what they do, because I can say, wow, this is what my organization has done for me. And I guess that's really as much as I can say for now, unless anybody has questions for me later. Mary.
Claire, thank you so much. I'm I'm in awe of you. I've heard you speak several times. You bring so much compassion and courage. And I guess maybe one of the questions that comes to me is, again, it's a difficult question to answer. But how do you start building that courage? I mean, if you're talking now to people who are listening in, should this come from the employees? Should employers just make the first move? Who needs to make this first move to just create this muscle of courage and really get the conversation going?
I think when I started, it was very much you had to do it yourself, but that's a very different time and a very different environment. We do now have in diversity and inclusion, wellness and well-being, all of those programs in organizations now that we can use to create the safe space for people not to have to be quite so courageous, but yet, you know, to have the opportunity to talk. It's something I always encourage people to do. Have you ever had a conversation, just a simple conversation over a cup of coffee? Drop it in, start talking about it on a lower level and explore. Maybe you actually will find that the person sitting opposite you also has migraine. It's a high possibility, or knows somebody in the family who has it. So you can't say that there's one particular approach, but I do think that the environment we work in now and those programs often give opportunities. And now that employers hopefully on this call are listening, they also have the opportunity to say, gosh, you know, this is what we explored this week. And this week we've learned that migraine is a lot more complex perhaps than we thought. Is anybody interested in having a lunchtime meeting to have a chat and share experiences and develop from there?
Thank you. Maybe ask Mary and Leo to come in and we can have a discussion between the three of us and see. Deirdre will let me know if there's any questions coming in the chat, if there's anything pressing at the moment. If not, I just wanted to bring something else up again. And apologies, because when the world went dark for me, I missed most of Leo's presentation, which means forgive me if I'm asking a question again. But Claire, you also spoke about how you were on the focus group for Novartis designing this program. And perhaps Leo as well might come in on this and say how important that is, that there's no assumptions made about, well, look, we've read a pamphlet and this is what migraine patients need in the workplace, so let's do this, this, and this. But perhaps you could speak a little bit more about how important it is that migraine is so individual and how important it is to actually have someone who's living with migraine to co-design a wellness initiative.
Yes, so for, I think Claire was referring to the leaflet that was shown at the very end, which is part of the basic educational campaign that is freely available to all employers in Ireland. However, you're referring to a very important point. You cannot design a patient support program without consulting patients, which sounds completely obvious, but very often in medical practice, we might not do that. So, but in this case, what we have done really is once we had this moment where people were voting with their feet and showed up in hundreds in this lunch and learn event, we actually invited people to come to focus groups to discuss in a first step what migraine means for them working at Novartis. And then we asked them as well in terms of what could be potential helps we could provide to them. And I think one of these potential helps actually was that when you see a lot of, you will always find patients, some of them have read everything about migraine and they probably know more about migraine than any professor of the world. But some of them actually might know very little, but even those ones knowing a lot sometimes then struggle as well with very human factors, starting even when you live with migraine, that you might not even have a person that really understands you what it means in the daily life. So that's why we then actually started designing this program, and where we said, look, on the one hand side, we need to leverage digital measures because there is cost restrictions to this. But at the same time, we want to ensure human empathy factor as well, and the human intelligence as well. We said we want to have lifestyle options included as much as medical options as well, as because we have learned before. And that we thought as well, we need to kind of shape the environment as much as we want to support the individual. So these were then all insights coming out of these focus groups that we had, and that we then used them basically as well as reference groups. So every time we kind of achieved the significant milestones, we went back to them and said, look, do you think this would be adding value for you in the situation that we have?
Super, thank you, Leo. And Leo, again, apologies, I did unfortunately miss your presentation. I know that you've published on this. Did you mention that publication in your presentation?
I did not. Thank you for reminding me. So this whole project indeed was a couple of weeks published in the journal Headache. Headache is kind of the leading scientific journal of pain in the head and in the face. And yes, so you can read it up there. It's freely available on their web page. And again, if you have an increased interest in learning exactly what was done and you want some more materials, it's our commitment as Novartis that we share all these materials so that if you want to kind of copy paste the program and build it in your own environment, then you have a great start.
Thanks, Leo. Actually, I did read that paper. I thought it was fantastic. And so if anybody wants a copy of that or a link to it, because it's open access, which is wonderful, you can email us, and I'll also put a link to it. I did already, but I'll do it again on our Twitter page. Leo, again, apologies if you've answered this question, but is it my understanding that this program is at the moment only in Switzerland, in Novartis Switzerland?
The program, as it is described in the Headache publication, and where we have these very scientific data generated, because Novartis is an evidence-based company, so of course we want to generate this evidence around this project, is available in Switzerland. It's available in Switzerland in the meantime by external providers who actually offer it to other companies, and we're having in the meantime a dozen other major companies purchasing the same type of integrated disease management to their associates. Similar programs are available in also similar pilots were conducted in other Novartis organizations in the different countries. So I can refer to Ireland, our Irish Novartis Ireland, not only these educational materials, but they have worked out a rapid referral triage. So kind of if you're an associate in a company, and very often getting access to a headache specialist might not always be that easy, or you might not even be aware that such headache specialists might exist. So there is a pathway that actually how when you work for Novartis in Ireland, you can, through their partners in the well-being area, can access to a fast assessment that then kind of does a triage in terms of who is the best person to help you, and then you're kind of being facilitated in access to the specialist as well. And I think if another company here on the call might be interested in this, then definitely it's worth reaching out to the colleagues at Novartis in Ireland. I have to open a bracket here due to Corona, access of private clinics and all of that. It's not always everything as it used to be, but fingers crossed, and in a couple of months, we are back to normal.
Thank you. So Claire, I might actually bring you in for this. I'm thinking there may be some people who are on this call saying, well, that's fine for a big organization like Novartis that have a lot of resources and they've got the budget that they can do this. But, you know, I'm stretched to the limit. I have a very, very small team that I'm working with, and I just don't have the resources. What would you say to them, Claire or Leo, or both of you?
Well, for me, it's all right to start small. It's all right to start, and starting is the important bit. So it's to maybe have that conversation, you know, facilitate the conversation. Say that you're going to have a couple with a chat over whatever the internal video conferencing is at the moment, seeing how most of us are fortunate of to still be working and they're working at home. And just open it up for a chat. See if you can find somebody who's a little bit more willing to have a chat about their experience. You know, I share my experience when I do these things. I'm lucky I can kind of flex between being a parent, being an employer, being an employee, you know, manager and employee. But really, it's just important to have somebody who's willing to go, migraine is there, it's horrible, it stinks, and it affects me. How does it affect you? How do you feel? And, you know, I feel rotten. You know, I'm lucky I can tell stories. So, you know, in one of my organizations, I was coming down with a really, really bad migraine. I needed my husband to come and collect me. And the team knew what to do. So they found an environment where they could isolate the lights. Not easy in this particular building. So they found a filing room and put me on a chair, wheeled me into the room, and then sat outside the door to protect me from the people who would inadvertently open the door and go, oh my God, there's a human being in there in the dark. So it's just to be able to start the conversation. After that, it will gather momentum, and hopefully, you know, the company will find somebody like yourselves to come in and add to the chat by giving real facts, real direction, some indication of, you know, specialists like Mary who can have an interest in headache, who will look at it from a GP perspective, and then on through the path, if necessary, to headache clinics like BOMAT.
Claire, thank you so much. That's really great. I feel like there's a whole slogan there. It starts with a cuppa and a chat. It starts small. I love that. And thank you again for reminding me. And our regional development officer, Clive Armstrong, has also reminded me to remind you that at Migraine Ireland, we are able to come to your organization, obviously not physically come in, but we can certainly do a virtual presentation, technology allowing, to speak to any employers, and we can certainly work with you on that. And we really encourage you to get in touch with us and to let us know what your requirements are, and work with us, please, and let us work with you to develop these migraine friendly initiatives in the workplace. Mary, I'm really conscious because I'm praying that my phone stays okay for me. So I'm conscious that I can't see you. But is there anything that you would like to, we're kind of coming towards the end now. And I suppose maybe I'd like to ask each of you in turn for maybe just one key takeaway, one thing that you would really want people who are listening in on this call to take away. So perhaps Mary, we'll come back to you.
Well, I'm going to take Leo's takeaway that he gave in the middle of his presentation. And he said, it's about lifestyle and medication, and maybe a chat with Migraine Ireland. And I'd just like to say to the audience that Migraine Ireland, or our Migraine Association of Ireland, identified a need for education of general practitioners, which was the initiative for me doing the document. And we had Migraine Association of Ireland review the document and patient input. My only downside is it wasn't particularly written in a plain language form. And this is the hope for my current document and for the update of the migraine one in the future.
Mary, thank you. And thank you for all that you're doing to just create more understanding and to give hope. I'm going to come back to that again, to give hope, because there is hope. There is hope.
There is hope, yes. Yeah.
Thank you so much, Mary. Leo, actually, I did get a question. Mary had mentioned in her presentation about the Migraine Buddy app, and I did get a question here to say, is that associated with Novartis?
The Migraine Buddy app is from an independent startup based in Singapore called Healint. We are working with them on certain projects, but we're not associated, or they're independent from Novartis.
Okay, thank you for that clarification. Thank you. Leo, what perhaps Mary has stolen your takeaway perhaps, but is there one thing that you would like people to take away from this presentation? Just one sentence, one thing that they can do. Perhaps maybe what one thing can they do when they come off this call, this seminar?
My key takeaway is start being sensitive about migraine. Migraine is everywhere around you. And very often we are just too ignorant to see it. And so was I. I'm one of these Saulus to Paulus stories. I didn't see migraine. I didn't think it was an issue for the longest part of my life until I became sensitized. And once you sensitize it, then then people will come to you. I know so many people living with migraine that I know for many years, and they told me only 2 years ago that they would have migraine because I was not approachable for it. And if you do that, that's the first step, and everybody can do that. You can be that friend with your drinking buddy. You can be that friend to your colleague. You can be that open everywhere. And if you're in a leading role in a company, turn the question around. Don't wonder whether you can afford to do something for people living with migraine. Can you afford not to do something for people living with migraine? When it shows you the loyalty that you gain, when it shows you the return of investment and the pride you generate in your organization, it can be a major platform for you to achieve many of your culture and as well health and even financial objectives.
Thank you, Leo. That's very powerful. That's extremely powerful. Thank you. Thank you so much. And we really appreciate you taking the time to share the learnings from the migraine, the initiative, the wellness initiative. So thank you.
My honor to be with you.
Thank you so much. Claire, I'm going to thank you. Thank you so much. We so appreciate it. Claire, I'm going to come to you, and I'm going to leave the final word to you, although I don't know if you can improve on just having a chat and a cuppa, but let's see. Is there anything in particular that you would like to just finish this conversation with?
I have 2 points to make, if I may. One, I want to recognize the fact that we've had over 70 people join this call, which therefore means quite a few of them may suffer from migraine. If you do suffer from migraine, a number of the things that we've discussed here are really key. One of the things I want to remind people about is Mary's point about diaries. Don't take them lightly, they're really important. Make it easy though. And whilst paper diaries are fantastic, and many of us are still in that era where paper diaries are much nicer than having to do something electronic, I use Migraine Buddy every day. It's really easy to use. It's like having a little friend in your pocket because it kind of gives you a sense that somebody's keeping an eye on you and cares, because it's really well written, very quick to fill, and helps me when I have a conversation with my medical team. But from a sufferer perspective, talking to employers, I want to be my best self in work. It's really important to me. I do not want to be that presentee person who's just there suffering in pain, struggling to do my best. I want to do my best, and I want to feel that my employer is on my side and has some understanding and partners with me in that. I may not be a person in a wheelchair who has to be facilitated in those type of manners, but I have a disability. I have a disability that doesn't take a lot to support. And it's worth supporting because I can give so much more when you help me that little bit.
Another very powerful testimony. Thank you so much. Thank you to Mary, to Leo, to Claire. I have to also say thank you to my colleague Deirdre, who was my wing woman when technology failed. So once again, sincere apologies for my technology disaster. This will be recorded. I hope you will be kind and ignore all the things that went wrong. And really, I'm sure you will, because you'll focus on these three incredible presentations that we were in the Migraine Association of Ireland extremely honoured to have the three of you speak today, to give your time. I'm sure you'll agree that it was incredibly powerful. So I'm going to end today's session. Again, thank you also for attending. And as Claire said, the fact that you showed up in such high numbers really shows that you do care. You care about what it's like to work with migraine. So just one last thing to say is please do feel free to email us at info@migraine.ie. And yeah, please follow us on social media as well, on Twitter and Facebook at Migraine Ireland, and we will be sharing these slides. We'll be sharing some more information. So once again, thank you so much. It's a bank holiday weekend here in Ireland. I'm not sure if that means anything to us anymore in lockdown, but I wish you all a very safe and a lovely bank holiday weekend. So thank you again, and thank you especially to our three wonderful speakers. Thank you.
Bye and good luck.
Bye-bye. Have a nice long weekend, everybody, and stay safe. Huh?
Thanks.